Pilates has been the movement of the moment for quite some time now. Appearing a few years ago, as if out of nowhere, this unique form of exercise has taken the world by storm. But it's not just another flash-in-the-pan trend. Actually, Pilates has been around for over 90 years. Joseph Pilates devised the exercise regime in Germany, using simple machines and springs to help rehabilitate people injured in World War I. His exercises seem to hasten the recovery of patients, and his regime has been embraced by the performing arts world since the 1930s for quicker recovery from injury. Dancers in particular have long understood the benefits of Pilates. Today, Pilates is making its way back into the rehabilitation arena. These physiotherapists are being taught a revised form of Pilates, clinical Pilates, renowned as the approach that started the resurgence of interest back in the 1990s. In the 1980s, Australian physiotherapist Craig Phillips took his experience as a professional dancer with the Australian Ballet to revisit Pilates with a scientific medical eye. He translated evolving research on spinal stability into Pilates, starting with reconditioning of the spinal muscles, particularly in the lower back. Using research, many of the original exercises have been cut, and what's left is a set of now proven, powerful, effective exercises known as clinical Pilates. Craig, the director of DMA, is making sure the physiotherapists he teaches are rigorously trained in the fundamentals of clinical Pilates to get the best effects with real patients, building on their postgraduate knowledge at the bachelor, master's and PhD levels. There are currently over 8,000 such trained physiotherapists in over 14 countries using clinical Pilates in hospitals, military settings, sporting and Olympic teams, dancers, actors, singers and musicians, as well as general and neurological patients, to just name a few. Clinical Pilates differs from conventional Pilates and exercise in a number of ways. The main focus is on training movement stability rather than core stability, by reconditioning the neural pathways, driving muscle movement from the spinal cord and brain. Strength and strengthening of the muscles is secondary and actually much more achievable and effective if the neural system is working optimally. Known as the motor control approach, this form of implicit muscle training is the most effective form of motor control training and is the next step beyond current cognitive approaches. The exercises themselves also act as treatment tools which assist traditional manual therapy and diagnostic. The first step with clinical Pilates is taking a full medical and physical history to see if there is a pattern of injury, something which is very common. The body is looked at as a whole system, as an injury in one area can have a cascading effect to other areas. A program matched specifically to that patient, based on a directional bias, is then developed and can be accurately measured for effectiveness. Craig stresses the importance of breathing to his class. Traditional exhaling on effort and bracing the abdominals is not safe, leading to pelvic floor problems and hernias. Instead, the correct employment of the diaphragm, breathing in on effort, is crucial to stability and balance. This identifies if injuries are related. This is very common with chronic problems, with injuries following a pattern rather than occurring as isolated events. So treating or even performing surgery generally doesn't fix the underlying problem and the chronic cycle continues. ACL knee injuries are a typical example where repairing the ligament does not fix the underlying problem, which is why so many recur. Traditional Pilates use floor work exercises first and then graduated to using the machines. Clinical Pilates works differently, using the apparatus to teach the system more quickly and help identify injury problems. It's similar to learning to drive, sitting on a chair or sitting in the car to teach your brain properly. Pilot studies on Olympic athletes, sportsmen and injured patients are showing this to be true with improved performance. Breathing is key to any form of exercise, whether it be yoga or aerobics, and load can have a significant effect leading to bracing or Valsalva effect. Chronic joint and back pain is a looming problem as the baby boomer generation grows older and cost rise. With the healthcare climate changing rapidly, we could well see clinical Pilates as the highly specific exercise capable of saving billions of dollars.